addressed in a serious, systematic, and deliberate way. So this panel just creates some space to ask ourselves some questions. What is the relationship between structural racism and the healthcare system? What is the relationship between universal healthcare and anti-racism? How does our for-profit healthcare system interact with and prop up racism in our society? Where has our movement been successful in building a true multiracial working class movement? And where have we fallen short? And what can we learn from those successes and failures? And how can we address the role that colonialism plays in how our healthcare resources are allocated? And what needs to change for us to get to that point, to a point where we have a truly multiracial working class mass movement? What needs to change both at a movement level and an organizational level? So with that, we're going to spend most of this workshop talking to our incredible panelists. And first, I'm going to hand it to Claire Cohen. Dr. Claire Cohen is a child and adolescent psychiatrist. She's been practicing in Pittsburgh since the 80s. She grew up in Philadelphia and attended Hahnemann Medical College, and then did her residency at the University of Chicago. She did a fellowship in child and adolescent psychiatry at the University of Pittsburgh, and then she fell in love with Western Pennsylvania and has practiced there ever since. She's worked in a number of settings: community mental health clinics, partial hospitals, school-based settings, and inpatient hospital settings. But in addition to being an incredible physician, she's always been very active in her community. In the late 1980s, she was involved in supporting the strike of the Pittston coal miners. In the 90s, she was a member of a group that fought to get a civilian police review board in Pittsburgh. And more recently, she has been involved in efforts to stop the school to prison pipeline on the Pittsburgh public schools, and in fighting for Medicare for All as a member of Physicians for a National Health Plan and the Western Pennsylvania Coalition for Single Payer Healthcare. So I am very honored to introduce Dr. Claire Cohen. Take it away.
Thank you. And I'm also the co-chair of the Pittsburgh DSA Health Justice Committee. So, all right. So I wanted to focus on how the mobilization of Black people, particularly Black working people, is crucial for the success of this movement, and how Medicare for All is crucial for health justice for Black people. And I was going to start with a simple demographic fact to explain why it's so crucial. So 2/3 of Americans are working class, according to the Economic Policy Institute. 2/3, that's the majority of the population. Of the 2/3 of that working class, people ages 18 to 25 are already majority Black and brown, already. Okay. And on top of that, people ages 25 to 54 will be majority Black and brown by 2029. And by 2032, all working class people will be in the United States will be majority Black and brown. So if we don't get on top of this, we're in trouble, because we won't be reaching the majority of the working class in this country. The second reason why this is so crucial is, I don't know how many people have heard of, I was surprised to find out that there are people who don't know who Representative James Clybourne is. He's a Democratic Black congressman who's part of what Black people call the Black misleadership class. And he has made it very clear publicly that he is going to lead the Democratic Party in the charge to pull Black people away from Medicare for All. And the argument is going to be, out of loyalty, the Black race should support ACA, because that was our first Black president who set that up. And by extension, loyalty to Joe Biden. And while some young Black people are not going to buy that, people unfortunately my age and so on, there's a very good chance they could, and that could really hurt us. Now, you may say, well, how do we know Clybourne can do this? This is the guy that single-handedly pulled Joe Biden from the ashes and buried Bernie Sanders' campaign in South Carolina. So he has a lot of power and a lot of say. And if he decides to help the centrist Democrats do that, he could very well. So we have to get our act together and bring in, not just as a side thought or a sideline, bring in to the leadership of our movement, the Black community, or we could be really fighting an uphill battle. And so the question is, how are we going to do this? What do we need to do to counteract that strategy? So there are a lot of things that, if you look at it, we could use very easily in terms of making the argument for Black people. And then at the end, I'm going to present some ideas of how we connect, who we connect with, and some of the strategies or strategies we can use to help correct this error that we've made by not having Black people and brown people central in the movement for Medicare for all. So first of all, if we look back at the history of racism and segregation in the United States, and the horrific, I don't know if any of you have read the book called Medical Apartheid, the horrific history of how Black people were treated medically in this country, you'll know that how we finally made some real headway in the issue of health justice for Black people in the United States was Medicare. It was through Medicare that we were able to desegregate hospitals. Before the 1960s, and I'm old enough to remember this as a child, Black people had their hospitals. In Philadelphia, it was Douglas, I think it was called Mercy Douglas, it was called hospital. And elsewhere, there were hospitals elsewhere. And the name of the congressman, someone's asking, is Clybourne. This medical treatment for Black people was horrendous. It was, we think it's bad now, maternal death rate, 40 out of every 1,000 Black women dies in childbirth and so on, but it was much worse then. But Medicare, with the advent of Medicare, the US government was able to say to hospitals all around the country, you have to desegregate or else. So we know that with a single payer, public, single system, we can make some real dents in some of the racism in our country in medicine. But with this piecemeal private system, we can't. So some of the areas where would make sense for Black people, number one, there's studies showing that Black people do better with Black doctors, Black providers, okay? Not because white people can't treat them, but because of implicit bias on the parts of whites, and also because Black people tend to follow the instructions of, especially Black men, Black doctors better, and they trust them more, okay? Well, in our current system, you have siloing. Your insurance determines who you see. And I have this happen with patients who want to see me all the time. If you don't have the right insurance, you can't see that Black doctor. And you might have the right insurance and be able to see that doctor, but your job changes your insurance to a different company, or you lose your job, you lose your provider. That's not happening in Medicare for all. Medicare for all, you see who you want, whenever and wherever you want to see them. Another argument to make for people, for the African American community, is that all people have all people, not just Black, there's the issue of lack of insurance and underinsurance, okay? But for people of color, and particularly Black people, it's even worse. So I'll use an example of breast cancer. So Black women are 17% more, or no more likely to get breast cancer than white women, but they're 17% more likely to die from it. So they did a recent study looking at the cases of thousands of Black women. What did they find out? They discovered that in 50% of the instances, the issue that led to Black women dying from breast cancer was that they weren't able to pay co-pays and deductibles. So they delayed care, and by the time they got care, they died. And that hit home for me because in my family, we have this breast cancer issue. So a couple of years ago, I had to get a diagnostic mammogram for a suspicious lesion. It cost me $1,000 for the deductible. I'm a doctor, so that was an ouch. I could juggle things and pay it. I had a cousin, my exact same age. A couple of years before that, she was not a doctor. She worked as an administrative assistant in somebody's office. She had this exact same problem. She couldn't afford to pay the deductible. By the time she could afford to get care, she had metastatic breast cancer and she died. So that study really hits home for me because I lived that experience. Okay. Some other issues for Black people is many times the facilities they go to are under-resourced. They don't have the best, they're not able to give the best care or the most up-to-date care or have the best equipment. And that's because, once again, hospitals determine where they are. And sometimes the hospitals even close. We've had this problem in Pittsburgh where hospitals and communities most needy close. So what's the problem? The problem is that you have these for-profit hospital chains. They want to make money. They don't make money in poor areas, so they close and go to places where they make money. That doesn't happen in Medicare Care for All because you have global budgeting. You determine where the care and help and resources are needed, and that's where the hospitals go. I could talk all day about the problem of Medicaid, but that's one of the biggest problems because Medicaid, the problem with Medicaid is the states determine eligibility and they can set restrictions and limits. And guess what? The states that are most predominantly people of color are the states with the hardest eligibility hurdles and the most difficult restrictions. So I have family members, once again, because I have family members all over the United States, from California, Texas, Georgia, you mentioned it, who can't get it, don't have any health care, okay? And I could sit here all day and tell you stories about that. But Medicare, it's a federal, public, single program that can mandate and say, you got to cover, you got to take care. Everybody's going to be covered. All right, so I'm just going to end. I didn't time myself, so I don't know if I'm behind or not, by talking about some of the things that I think we need to do like yesterday to help us get up to speed. So we have one fabulous opening right now in that the new president of the Physicians for a National Health Program is this fabulous Black woman physician from Chicago. And she is excellent, Dr. Susan Rogers. So I think one of the things we need to do is get together with her. I've heard her talk a couple times already. And when she talks, she's convincing. And she brings up all the same things that I do and more. So I think we need to get together with her. We need to see how we can get her around. She's a powerful figure. She has authority. Get her around to Black churches, Black unions, all these different places to counteract some of this impact. Okay, Dr. Susan Rogers was, and there's, by the way, there's several other really good Black women physicians in the head of PNHP. The second thing is that there are two groups I think we need to hook up with: Poor People's Campaign and Put People First. We need to reach out to them. We need to talk to them, and we need to connect with them about how we can together collaborate on getting the message out there and getting people into the movement. Number 3, Movement for Black Lives / Rising Majority / Working People's Party / Frontline. They're the ones that did all this phone banking that got Black people calling in and helping Biden to win. They have conference calls where there's 20,000 people on a call, and they're supposedly working on this progressive agenda. Their line about healthcare is like this. One sentence saying, we believe in universal healthcare. We need to talk with them. We need to reach out and help them develop and help them see that as part of their efforts, they need to push Medicare for all. And I think they would be receptive, but we need to connect. And last but not least, this is just one more, but I'm sure there's more other people can come up with, is we need to reach out to our Black labor union members, and we need to reach out to Black professionals who are, because I know some Black doctors and social workers and so on who are for Medicare for all, to help bring them in to help us build the movement. So that's just the beginning, but we need to do those things yesterday. All right. Any questions?
Thank you so much, Dr. Cohen. Yeah, we need to do these things yesterday. You put it so well. Okay, and we don't have a ton of time, so I'm going to go straight to our next speaker. And if we do have time at the end, we'll do a little Q&A, but mostly we want to hear from our speakers. So next we're going to go to Dr. Sarah Huertas, a retired professor of psychiatry from the University of Puerto Rico. She served for 2 years as Deputy Secretary of Mental Health and Addictions of the government agency in Puerto Rico. And she's an activist for mental health and universal healthcare systems for more than 2 decades. She's also a co-founder of numerous community advocacy groups, both around health and mental health in Puerto Rico. And she's currently a member representing the area of mental health in the Multisectorial Health Council, an entity that was created through a citizen-initiated bill that in 2015 resulted in the creation of this council, and the members are elected by their own constituencies. She's also a DSA member and was a Bernie Sanders delegate from Puerto Rico in 2016, and most recently was appointed Healthcare Justice Advisor to the Citizens Victory Movement's Legislative Caucus, a new left-wing populist party in Puerto Rico. So I will hand it over to Dr. Huertas. Oh, Dr. Huertas, you're muted.
I always do that. Again, thanks for the opportunity. Thanks for your introduction. I love being here with this group of great advocates in the panel and out there in the audience. And I will jump right into the points I would like to communicate today as time is short. I will not be discussing the area of Latinos and Puerto Rican, particularly issues in the U.S., as often the perspective of Puerto Rico from Puerto Ricans is not heard too much in mainland organizations and mainland discussions. So I will focus essentially on what can the perspective of somebody from a colony of the US bring to this struggle for justice in health and a universal healthcare system involving multiracial actors. Puerto Rico is a multiracial colony, one of the oldest in the world. National Geographic has proclaimed Puerto Ricans to have one of the biggest genetic diversities and mixed ancestry in the world, which comes from our history of having suffered the cruelty of the Spanish attack and enslavement of Native Americans, Taínos, and Africans, and the addition of others in our 500 plus year history as a country, as well as the particular nature of our colonial history. Fortunately, there has been both a genetic and cultural persistence of these peoples. We also have a colonial history with the US, invaded during the Spanish-American War in 1898 and remaining as an unincorporated territory of the US to this day. We are citizens since 1917, gained a measure of self-governance in 1950, and benefited from New Deal policies in the US at that time, as well as local and federal enlightened leadership in the 40s to the 70s. We have also experienced political oppression of the independence movement, but during that time period, 40s to the 70s, it was also accompanied by progressive social policies in health, education, and infrastructure, for example. So that's what I would like to talk a little bit about, because I think it's important for people to hear how it's different when you have a different health system. I think something that perhaps most people in the US have not experienced. So, in health, particularly that period of 40 to the 70s, in conjunction with other progressive policies like free public education, free at all levels, essentially, housing, employment, etc. I'll also add a bit about what happened subsequently with the neoliberal policies of the privatization of health services. And I won't dwell on those because I think most of you know about that already. And Claire has done a wonderful job of talking about the problems that presents. So starting in the late 40s, we had one of the first experiences in the world with community healthcare. Our system was essentially public with focus and attention on the most needy, but open to everybody, literally, free and no questions asked. I grew up and I trained as a doctor in such a system. The great majority of hospitals were public or nonprofit. There was a primary healthcare center in every town and multiple in cities. The system was organized with referrals to secondary hospitals and specialized hospitals, tertiary care in several medical centers in the cardinal points of the island, which was the result of something called planning. These hospitals supported training of all kinds of health professionals. And in addition, in the usual sites, in the same sites as these primary health centers, there were what were called public health units, taking care of vaccination. Imagine that. Imagine if we had that in the States and here right now. Community work with visiting nurses and integrated mental health care, which we are advocating now 50 years later. We're still advocating for that. Result? Well, these health policies and other social policies for Puerto Rico set essentially world records for improvements in the most important population health indicators, life expectancy, mortality, child mortality, infant and child mortality. But as economic development following a foreign investment model proceeded, however, the upper classes, as in many places in the world, deeply connected also to race, advocated for the entrance of private insurance. And eventually in 1993, the step to privatize public services through managed care was taken. Hospitals and community centers were sold, and the cost of healthcare grew incredibly, becoming a booming business, although Puerto Rico received for many decades only about 20% of what the states would receive in Medicaid. We still continue to have a difference of how Puerto Rico is treated. Although that's another story, and if somebody has questions, I will talk a little bit more about that. And even though almost half our population qualifies for inclusion, about 50%, 58% of children are under the poverty line in Puerto Rico right now. Probably more right now. The previously described system, the one I was talking about from the 40s to the 70s, 80s, was essentially destroyed. How we managed to maintain a life expectancy at the level or a little higher than the US is a question. I have my own answers, but I can't go into that right now. But still, our system could not face the tragedies of Maria, the hurricane, and now COVID. Maria, however, presented another lesson. If before we had learned about impact of public policies on health, Maria taught about the danger and the lost lives of policies from policies that result in fragmentation, in poor infrastructure of services, in great inequities, and when a system's health, country's health system is done through the for-profit motive. However, it also taught us about resilience, as quietly behind the scenes, communities still held on to the values of our previous health system with access, solidarity, and leadership. We saw incredible volunteerism and efforts from communities and from the population in general, as well as from others from the diaspora and US, other countries. Some communities that we saw set up their own little community health centers with support from other entities, set up by themselves, just as they cleared the roads by themselves and all of that. I am sure you're aware that there was so much dysfunction or corruption in the system that they could not even properly count the fatalities related to Maria. On this subject, I refer you to a recent book by Naomi Klein called, titled The Battle for Paradise. Puerto Rico takes on the disaster capitalist, which focuses precisely more on the response, although also some of the things which Puerto Rico is currently now undergoing. So in summary, government policies are important. They cause tremendous change that we have experienced in our own lifetimes in Puerto Rico in both directions, and never underestimate the amount of community solidarity and power once they are mobilized. My second point has to do with what to do, successes and failures. I have been a long-term activist for a universal healthcare system and I'm a member of many groups, but one we co-founded like 12 years ago, I think will bring a couple of lessons as well as problems to this discussion. This group, I think, was special because it brought together people who do not usually flock together. Labor, community, human rights, women's rights advocates, religious leaders, professionals of different disciplines, not only health and public health, but education, economics, law. In common, they all had, or we all had, believed in universal health care. The governance for this group was very horizontal and sometimes produced problems, but gave us also a sense of equality and trust. We started through a process of trans group self-education, which resulted in the idea of writing a citizen-initiated bill. We had tremendous help from labor groups from Puerto Rico and New York, who are definitely much more knowledgeable than many of us were in lobbying and in politics. It was accepted by a few legislatures and leaders, including the president of the House at that time. And to summarize the story, after 3 years of effort, the bill became law. It was mostly what we wanted in terms of the purpose to continuously study our healthcare system. Basically, we wanted to be watchdogs over the healthcare system and also offer alternatives. And this was included in the law, as well as our principles of representation. We had, this was one of the most important principles, that we should have representation both in this group that was going to be created, as well as in the running of the health system at all levels. That was a most important point. Well, after 3 years of effort, the bill was passed. It became a law. Although, as you'll suspect, it was not exactly the same bill we submitted, but we have to say that the idea of principles, representation, independence from government were maintained. And although the members of the council were not exactly the ones we proposed, the spirit was in general preserved. Unfortunately, the legislature did not include funding and a real mandate for information, which we wanted. but it did permit the sharing of information from government agencies, and the support for administrative things was granted through the University of Puerto Rico. And the council has been working for the past 5 years, and slowly but surely has had some impact on organizations as a voice for universal health care in the legislature. For example, for the executive, the legislature, the Congress created US appointed junta or oversight board that you might have heard of that now controls the budget and legislation in Puerto Rico. And finally, and I will be ending with this, it got the attention of two progressive political parties being included in their political program, both the council and single payer. And I just have a couple more sentences. These parties gained enormous momentum this last election between the two, capturing almost 30% of the vote in Puerto Rico. So I consider that to be a really important gain. And ironically, one of the things that has been a problem is that one of the things that they did not approve for us was funding. And that had an effect on our ability to get the community more involved. And this is one of the problems we face. The lessons from all of this is that sometimes there is distancing between the thinkers, organizers, liberal educated, middle and upper middle classes, I would add white to the quote, and the actual participation of communities and those most in need, add people of color. And although we see promising signs in the Puerto Rico and the US, I think there is a way to go. We face a very tough, powerful domination and a resistance that has been mostly fragmented, but with very good signs, both in the US and in Puerto Rico, I think, that people are coming together around that asymmetry of the powers we face, which is not completely capitalist, but also racist, colonialist, and patriarchal. So we need that for a successful Medicare for All movement. The participation at all levels of people of color. So our organizations need to deliberately invest and look out for this integration. Thank you.
Thank you so much, Dr. Huertas. I certainly couldn't have put it better myself. Okay, I'm gonna hand it next to our last speaker, Jose La Luz. Jose La Luz is a veteran organizer, campaigner, and labor educator in the labor movement in the US and Puerto Rico for more than 4 decades. He's held senior staff positions in AFSCME and ACTWU, amongst other unions. Jose led the grassroots campaign to achieve collective bargaining rights for public workers in the Commonwealth of Puerto Rico. The enforcement of Law 45 in 1998 paved the way for one of the largest coordinated organizing campaigns in organized labor's recent history. More than 120,000 workers were organized, and La Luz became the founding executive director of Servidores Públicos Unidos, AFSCME Council 95. Brother La Luz retired from AFSCME in 2014 and later served as the public policy coordinator for CSEA, an AFSCME affiliate in New York, until the end of 2017. Since 2018, he has devoted his energies to campaign and organize Latino support for Medicare for All in Florida and Texas in collaboration with Labor for Single Payer, the Debs Jones Douglas Institute, and DSA Medicare for All Campaign Steering Committee. He was the closing speaker at the strategy conference in Minneapolis in 2018, and he brought down the House. Recently, he served as a national surrogate for Senator Bernie Sanders and campaigned heavily with Latino workers in Nevada and Texas. So Jose La Luz, take it away.
Thank you so much, Frances, and I see a lot of familiar faces in the audience today. It makes me so happy that we are reconvening again to examine what are some of the challenges that our movement faces at this political moment, and what are some of the things that we need to do in order to overcome some of those challenges. This question of race and systemic racism and white supremacy, I would submit that is in fact one of the fundamental reasons why we do not have a universal healthcare system in America. In fact, had the Reconstruction Revolution been successful in the 1860s in this country, I suspect that we would have achieved universal healthcare, and we would not have to be having the conversations we are having today. It's interesting how this question of systemic racism becomes so glaring in the face of this serious public crisis that we are facing today, where we have seen that a lot of the people that have died as a result of these racial disparities and inequities in the American healthcare industry, because we do not have a system to speak of, we have an industry, have demonstrated that there is an urgent need to address, this question of achieving healthcare for all in America. And I believe that for us as social and political activists, the question of how to build a multiracial movement that can in fact achieve universal healthcare is of the essence in this very moment today. And let me speak about what I consider to be some of the most serious challenges in terms of being able to build this multiracial movement for universal healthcare that we have been discussing. I believe that the American healthcare industry is in fact one of the defining features of the American capitalist system. And what I mean to say is that the fact that there is no universal healthcare in the wealthiest nation on the face of the earth is not only a travesty, but it's in fact an aberration, because most countries around the world, even poorer countries, have at least a robust public health system, public healthcare system. Most of the people that come from the part of the world that I come from the southern part of the hemisphere, in the Americas, are familiar with this thing we call salud para todos, healthcare for all. People in countries like Argentina, Costa Rica, Uruguay, Chile, even in El Salvador, in Cuba, in Mexico. In fact, most of the countries in the southern part of the hemisphere have some kind of public healthcare system that does not result in thousands of people dying for not having access or healthcare coverage. So I am suggesting that the American healthcare industry, it is not only a travesty and an aberration, but it's in fact a murderous industry. And this has become most glaring right now in the middle of this pandemic. Who are the people that are dying by the thousands in cities like Los Angeles, in many cities across the states of Texas and Arizona, right here in New York City, where I am, people of color, working people of color that do not have access to healthcare, immigrants are in fact, the rising, most of the people that are dying as a result of this catastrophic public healthcare crisis that we have in America today. And many of us who are activists in this gathering know that the only way to change that is to build sufficient power to be able to transform the political landscape that would allow us to enact legislation that would in fact make universal healthcare a reality. The challenge we face is that despite the gains we made, and despite the fact that we defeated a neo-fascist, white supremacist, right-wing government that was predicated on the notion that some people are superior to others, and the systematic use of hate speech, which resulted in this latest assault on the US Congress on January 6th, despite the fact that we elected a liberal president whose name is Joseph Biden, who is a Democrat, you and I know that we are not anywhere nearer to getting universal health care enacted in this country. That is going to take an incredible fight, that we will have to build a powerful mass movement, and that this mass movement will have to include many of the people that are the victims of this universal, of this severe, serious healthcare crisis that we are facing in America today. That will require an intentional and deliberate strategy to reach out and to incorporate people of color in this fight. We need to turn this into a mass movement. Indeed, we need to turn this into a popular movement. This does not get accomplished if it continues to be essentially a majority white people's movement. And I say that with a lot of respect. We need to have the main victims of this movement become many of the faces that are taking the fight to the Congress, not only in Congress itself, in the halls of Congress, but in the streets around America. This has to become a movement that makes the case that universal healthcare is actually a movement to save lives. Ours is a movement to save lives. People talk about, saving lives associated, with abortion. This is a movement to save lives. This will make sure that tens of thousands of people, working people, do not die as a result of not having access to healthcare in the wealthiest nation on the face of the earth. Now, let me suggest to you, sisters and brothers, colleagues and comrades, in fact, in this struggle, that we have to do a number of things that are very different than many of the things that we have been doing for a while. Dr. Cohen was telling us about the story of James Clybourne, this very prominent Black member of Congress, who wields tremendous influence in the Democratic Party today. That is also the story of many of the Latino political elected officials in Congress and many of the Latino national and regional organizations. They do not support universal health care. Why? Because they are in collusion with many of the same Congress members that get elected with the money they get from donors from the pharmaceutical industry, from the American Hospital Association, from wealthy donors that believe that it's fundamental to keep this industry a private profit-driven industry. And they will do absolutely everything and anything to defeat the achievement of universal health care in America. So I am suggesting that we need to build a movement that organizes the indignation of people, that actually organizes and mobilizes the indignation of people. And why not say it? That actually organizes and mobilizes the rage of people. Because what cannot be a reason to be angry than the possibility that you can actually die for not having access to healthcare, or some members of your family will die for not having access to healthcare, or you would have to invest your life savings in order to save your own life or the life of the people that you love. This is absolutely unacceptable on the wealthiest country on the face of the earth. And we have to fight. We have to make this a hell of a fight, I dare suggest. So what are some of the things that need to happen? Okay, so most of the unions in America that are part of this private profit-driven system that have a slice of privilege because they have been able to negotiate collective agreements that allow their members to have access and privileged access to healthcare may not be joining this fight. But there are some unions that are involved in this fight. The National Nurses United is involved in this fight, and that is a fight that represents workers, healthcare workers, and healthcare professionals. Why? Because nurses know the meaning of fighting for people's lives. Nurses are the people that save people's lives. Nurses are the people that have saved the lives of many of the people that are dying in those emergency rooms today, and doctors and other healthcare professionals and healthcare workers. That union has a pivotal role in this fight. Well, I dare suggest that we need to enlist Latinos and African American and Asian Americans and Native people, the First Nation people who are dying by the thousands in the reservations in this country. That's another travesty. The people who were the first inhabitants of this land are dying in the reservations as a result of COVID-19 and this serious public health crisis. There are reasons enough to be angry, reasons enough to be indignant in this country about what is happening with healthcare. But the people in Congress are not feeling that heat. They are not feeling that kind of indignation that you and I know exist in the communities, in the barrios, in the places where people live and work and die in America. So what is it that we would need? Well, those of us that played a role in Senator Sanders' campaign discovered a number of important things. Senator Sanders succeeded in mobilizing Latino workers in Nevada, where I spent most of the time campaigning, including union members who had healthcare coverage negotiated in a collective agreement, the ones that work in the casinos there. You know what persuaded them when we were knocking doors in the barrios and in the communities where we were doing the outreach, knocking on doors? That this wasn't only about them, this was also about their families and neighbors. That this was about allowing people who are residents, who are not citizens, to have access to healthcare. That Salud para Todos has to become something meaningful, not only for them that have access through a negotiated collective bargaining agreement to healthcare, but to their friends and families. That's what made it possible for Senator Sanders to get the support of Latino workers in the election in California, in Nevada, and in Texas. But you know what that took? That took a very intentional and deliberate outreach strategy that took investment. The coalition of organizations that has been fighting for universal health care in the form of Medicare for all, which is the fight that you and I and all of us are engaged in this country, has to make a deliberate and intentional investment to reach out to African American, Latinos, Asian Americans, Native Americans, and other people of color so that they become front and center in this fight. And this would take a lot of organizing, as Frances was suggesting in the beginning, so that we can transform the face of this movement, so that we can make this a powerful mass movement, such as the powerful mass movement that many of us saw emerging out of the execution of George Floyd in the private square in the city of Minneapolis. That multiracial, interracial mass movement that took over the streets of America late in the spring and early in the summer is the model of the kind of movement that we need to build to achieve universal health care in this country. And I wish that our predecessor during the Reconstruction era had been successful and Reconstruction had not been betrayed in a bloodbath, so that you and I would not have to be having this conversation about achieving universal health care in America. But that reminds me that our movement is also an abolitionist movement, because we have not extinguished the Confederacy in the United States of America. The idea of the Confederacy exists. The best example and expression of that is what happened in the US Capitol January 6th. The only way we extinguish the Confederacy forever, one of the ways, is by achieving universal health care in America. I am determined to do this, to achieve this before I leave this planet. And I want to be part of a movement where people are prepared to fight with everything they have to make sure that those people in Congress vote not only because they are persuaded, but because they know that this is the correct thing. This will be an act of historic justice.
Jose, thank you so much. Oh my God. I don't know if you're checking out the chat, but people are really singing a lot of praise. And I think, yeah, someone said they're getting a little teary-eyed, and they definitely know that I am. Okay, so it's 2:43, so I'm gonna close us out. I know that everyone at this conference understands why Medicare for All is important. And if you chose to attend this particular panel, you probably came into it with a little bit of understanding at the very least of why Medicare for All connects to racism, racial health disparities in our society. And if you didn't know at the beginning, you sure as hell know now. But like Dr. Huerta said, there can be a disconnect at times from the organizers and the thinkers and the mass working class that they're fighting for. So we might understand it, but we need to feel it in our bones. We need to bring it to every single day of our Medicare for All organizing. We need to remember that building a multiracial movement is never just a buzzword or an afterthought or a nice thing to do that might happen someday. It is critical to our success. It is critically important to every single aspect of the work that we have. So you have to ask yourself, like, how am I organizing new members and new organizers of color into your organization? How am I developing relationships with organizations that are led by people of color, like Dr. Cohen talked about with reaching out to Poor People's Campaign and the movement for Black Lives? And how are you bringing people together who don't usually flock together, like Dr. Huertas talked about? And like Jose said, this is about saving lives. We need to approach this task as if our house was burning down and we were running out of water, because that is what is happening. And we need to take the moral task of this exactly that seriously. And I loved when Jose said, we have to organize and mobilize the rage of people, because people are angry and we have all these organizations and all this organizational infrastructure, and we need to move that rage into the movement. And that's it. We're closing out and we have a hard out at 2:45. So thank you so much to our panelists. I really can't thank you all enough. And thank you all for coming to this workshop. And tomorrow, oh yeah, tomorrow at 11, we're gonna do a little meeting in the Gather space that the conference is hosting. So if you want to come and talk these things out a little bit more, we'll be meeting in the North Room on Gather. And you should have gotten a written tutorial about how to use Gather and the link to go to the Gather. But that'll be a good place to have more conversations with both some of the panelists and with other organizers who want to talk out some of the incredible ideas that were put in the chat. Thank you all so much.